The very first post on my blog, I shared information about the daily sound check. So I thought, let's talk about why you should be doing that. If you're an SLP in a school or an early intervention and you have a student on your caseload with hearing loss, you should be doing a daily sound check. Why do we do it? If we have a new kid who's new to hearing, recently implanted, just got their hearing aids, we're doing it for kind of a different reason. We're doing it to help teach those early auditory listening skills, detection, discrimination, identification. We'll have another post on all that. We're actually teaching them to listen and to use that auditory channel to the best of their ability. So we want to really teach them those skills and that foundation. But we also want to do it to make sure we have a foundation, a baseline for what they can and cannot do at this time. That's so that when they come to school and we do that daily sound check, we're using it for a different reason. Now we're using it to see what's different. Do they have a dead battery? Is their equipment not quite functioning properly? Do they have a cold? Do they have allergies? We need to know what they can do, so we have that baseline, and then we have to keep data so that we can say, oh, today something's off. Why? What's different? And we need to know that maybe they're just having that bad hearing day. We also want to have that data so that if that child is going to go see their audiologist, they're going to go get a new mapping, they're going to get their hearing aids checked, we need to be able to say to the family or directly to the audiologist, you know, when I'm working with them, they're not hearing that, is there anything we can do? Or every time I present the ooh and the they're getting those mixed up. And maybe there's something they can do to adjust their equipment to help them access those sounds better. But that's our job. We need to make sure that when they are at school, they have the best access possible. Does it always have to be the SLP? No. I have the luxury of working with teachers of the deaf who can do this. I still do it when they come to my room for therapy. But if you don't have a teacher of the deaf, you can also train paraprofessionals, classroom teachers, and make it part of that daily routine. But we should be checking equipment through listening every day. For students who are aided bilaterally, cochlears bilaterally, sometimes one is working and one is not, and they don't even quite realize it or have the communication skills to tell us. I also try to always remember to check one side, then the other side, and then both, at least once a week, so that we can make sure both devices are working properly. But again, overall, why are we doing this? Access. Our students need the best access possible.